Does your dog make this sound? Or maybe even the answer for all of these might actually be way worse than you think. Coughing in dogs can be caused by a surprising range of issues. Some minor and some way more serious. So how do you know when to worry? Let's break it down. Hello everyone and welcome to Zooey's. Before we start, hit that subscribe button if you want to be part of the best pet channel on YouTube if you haven't done so already. First things first, you should know that coughing can either be by choice or it can be as a reflex. It's your dog's way of clearing their airways, just like us. But the underlying reasons for coughing can vary widely, all the way from harmless to life-threatening. Let's have we start with the most common one, infections. I'm sure you've heard of a disease called kennel cough. It's kind of like the dog version of a cold. It spreads quickly in places like boarding kennels and dog parks, hence the name. But another culprit could also be canine influenza or even fungal infections, depending on where you live, and that may determine how common they are. These usually come with a very deep, hacking cough, and sometimes you might even see a nasal discharge accompanied with signs like lethargy. But another common cause for coughing, especially in the USA, is heartworm. Easily preventable with proper deworming, very difficult and expensive to treat once the signs are noted. Your vet might prescribe the appropriate antibiotics and other medications as needed for these infections. Now, other issues like heart problems, including congestive heart failure, dilated cardiomyopathy, and even heart valvular diseases also cause these coughing sensations, especially in older dogs, and you might even notice the cough over a longer period of time. This type of cough is often wet or soft, and you might notice it kind of being more worse at night, after prolonged laying down, or even after exercise. It essentially happens because of fluid buildup in the lungs, which makes it harder for your pup to breathe. As mentioned previously, heartworm may also result in heart or lung issues, so be really careful. Medications that support the heart, such as pymabendin, and diuretics to help clear the lungs of the fluid, like furosemide, may be indicated to help treat these issues. Now, some smaller dogs like Chihuahuas, Pomeranians, and Yorkies are prone to a condition that's known as tracheal collapse. This type of cough sounds like what we call a goose honk. It's unmistakable once you've heard it in the past. Now, another issue, laryngeal paralysis, on the other hand, is more common in larger breed dogs and in older dogs. These conditions can make breathing noisy, and coughing is persistent and can even cause things like severe snoring. These conditions are sometimes managed, really well medically, but in very severe cases or advanced cases, surgery may often be the best option to improve your pet's quality of life. Now, other issues like chronic bronchitis or pneumonia can also lead to coughing. Now, it's important to know that pneumonia and bronchitis can often be seen together, and this is what we refer to as bronchopneumonia. These tend to be accompanied by other signs like wheezing, also difficulty breathing, and often fatigue. And excitement may also induce a cough. A lot of my clients that I see tend to see this issue when they have guests that are visiting. Sometimes allergies can also play a role, especially if your dog is sneezing or itching on their skin or shaking the ears as well. Medications to help open up the airways and reduce inflammation like cortisone or prednisolone may be the best course of action in acute phases. One could even give these medications with an inhaler, but this will take some practice. Check out this client. Now, unfortunately, coughing can sometimes signal something really severe and serious, like lung cancer or even tumors in the chest. While these cases are less common, it's really something that I always consider and discuss up front with my clients, especially if they have an older dog. Cancer in the lung can often mean that there is a tumor elsewhere in the body and that it has already undergone metastases to the lungs and will majority of the times worsen the prognosis for this patient. Treatments may include surgery, but often involves or at least form part of chemotherapy, radiation therapy, and palliative or supportive care. On a lighter note, of course, don't forget to rule out the possibility that your dog has swallowed something that they shouldn't have. A piece of grass, a small toy, a piece of bone, or even food can get stuck in the throat and trigger a sudden, violent coughing. This is something that I see so many clients start the consultation with, and I get it. It actually does sometimes sound like there's something stuck, and many times it's true. So if your dog is coughing and it doesn't clear up in a day or two, or even it gets worse, it's time to involve your vet. A thorough history taking alongside a proper physical examination may give your vet some direction to move in. Then, depending on what they found, they might actually suggest imaging, like with x-rays, blood tests, or more advanced things like a tracheal wash or bronchoscopy for deeper inspections. These tests help narrow down the cause and can rule more serious conditions either in, but hopefully out. So, how do you know if your dog's cough is an emergency? I want you to know that wherever you see concerning signs, such as coughing, and your dog shows other signs of disease or stress, it is always better to rather be cautious and get them to the vet. But some red flags may actually include coughing accompanied by difficulty breathing or panting, or even blue gums. A sudden onset of violent coughing after chewing on something, and you may also see severe salivation in these cases. Or you might see coughing alongside lethargy, appetite loss, or even vomiting. But for non-urgent cases, just monitor your dog. You can try keeping them in a calm, humidified environment and avoid any collars that put, unnecessary pressure onto their necks. Then also try to keep them cool, relaxed, and continue to monitor them closely. Note down all signs that you can, and you might need this to help your vet out later if it needs to progress to that point. Coughing in dogs can mean many things, from a simple cold to something way more serious like heart diseases or cancer. Knowing the type of cough and the other signs to watch out for can really help you decide when and how quickly to act. As always, your veterinarian is your best resource, but a pro tip is I want you to record your dog's cough on your phone so to show your vet what it looks and sounds like when they're coughing. Also, maybe take notes of what happened around the time of recording. But coming to a conclusion or making a diagnosis based purely on the sound or the appearance of the cough can really be a dangerous choice to make, even from a veterinarian. So, taking into account all individual factors and confirming any suspicions will be the best course of action with coughing. If you'd ever wondered what dogs and cats dream about, check out this video right here. It might actually surprise you. And until next time, cheers.